Cebu, which works as our spoke. So this is our desire that one day no Filipino will ever be afraid to get sick, and then Qualimed will be working towards that desire. So moving on, in the long term, this is what we want to achieve, creating a value-based healthcare wherein we redefine the patient's perception on quality and value. And then we would want to positively influence the health-seeking behavior of Filipinos. For us right now, for most Filipinos, we normally postpone our healthcare needs. We put it back and we prioritize more other needs. But here, part of Qualimed's advocacy is for us to change the health-seeking behavior of the Filipinos, wherein we try to reach the primary care, give them more access so that Filipinos will not just see a doctor when there is already a catastrophic illness. So that's our way of bringing down the cost of healthcare as well, because we try to manage the disease while it is still manageable rather than already at the end stage of the disease. And then as well as managing the healthcare expenditure by harnessing our economies of scale, we're also creating bundled packages and coming up with products and packages which is aligned with our national healthcare insurance as well as other payers of healthcare payers. So this is just our game plan. It's really covering significant bed population ratio, strengthening primary care through our access card, which we will discuss later, and addressing the doctor coverage wherein doctors would be readily available in all facilities at any given time. So this is just to show our spokes and hub model, and we cover, the Qualimed Healthcare covers from primary wellness to extended care. So this is where Qualimed is right now. This is where Qualimed is right now. That's Qualimed Blue Valley with a 100-bed hospital. And later on, we'll have one base hospital in north of Metro Manila and another one in South Metro Manila. So right now, we're covering 500 general service beds in Batangas, Iloilo, Bulacan, and Laguna. And we also have our ambulatory surgery center in the heart of the Philippine General Hospital. This is at the Faculty Medical Arts Building. That's our North Metro Manila Hospital. This is the ambulatory surgery center where we do elective surgeries. Also with Qualimed, in order for us to achieve our 3 A's, it's also very critical for us to put in place our doctor alignment. So right now, Qualimed has a group which we call the Qualimed Physician Associates. That's our doctor engagement model, which is a mix of employed doctors and fee-for-service doctors. And in the long run, we'd like to work on an outcome-based performance for our doctors. Earlier, I've mentioned in order for us to change the health-seeking behavior of the communities that we're serving, we have our enabler, our access card, which for a very minimal fee of about 1,500 a year, the member is entitled to unlimited access to a primary care doctor. And it also comes with a 10% discount for all Qualimed services, and with a 100,000 personal accident insurance of the member. The member can also nominate or enroll a dependent from 19 to 80 years old, wherein that dependent would also be entitled or have access to unlimited consultation and also discounts to all Qualimed facilities. The card also provides for an annual physical exam of the basic 5 for the member. And with Qualimed, later we'll show in depth what's special about Qualimed Santa Rosa is we have this training facility. Because one of our uh, goals for Qualimed is really to advance the skills of our doctors and medical professionals within the network. So Qualimed Santa Rosa, this is where we are now. We actually had our inauguration last July, and we've fully opened last September 2017. Our vision for Qualimed Santa Rosa is really to match New Valley as the biggest central business district in southern Luzon. And we would like to be the best alternative of Metro Manila Hospital. So we'd like all residents or communities within the area to choose Qualimed rather than going through the traffic in Metro Manila. So in Qualimed Santa Rosa, we have extensive coverage of doctors' subspecialty across all the major specialties. We also have a comprehensive surgical capabilities. We have minimally invasive surgery, ortho and opta subspecialty capabilities, and soon we will already be operating our lithotripsy. We also have a wide range of diagnostic imaging. We're the second in Santa Rosa to have a 1.5 Tesla MRI, and the only one in Santa Rosa with a 128 CT scan. So in terms of diagnosis, our doctors will be able to come up with better treatment plans because of better diagnosis due to our comprehensive and competitive diagnostic equipment. And we also have a strong doctor alignment through our doctor groups, that's Qualimed Physician Associates, and our ortho group, the Southern Luzon Orthopedic Group, and of course the Qualimed Training and Research Center. So this is what we offer. So we cover all the multi-specialty, we cover all the medical specialties. Our inpatient services, we have 5 types of rooms, from ward up to an executive suite. In terms of surgical services, we do minor, major, and all the minimally invasive surgeries through our endoscopy towers, arthroscopy, endoscopy, and laparoscopy. And then the critical care services, as listed, and the diagnostic imaging as well. Moving on. We also have a comprehensive laboratory, diagnostics, cardiovascular, and others. I think most of our corporate clients here are clients of our industrial and occupational health clinic. We will also be coming up with our travelers clinic to cater to the expats and executive foreigners within the area. We have an 8-seat dialysis unit and intravenous chemotherapy. And to support Nuvali's active lifestyle, we have the Rehabilitation and Sports Medicine Center and Pulmonary Services. Later in April, we also will be launching our Eye and Vision Center. So just to walk you through, this is our operating room, wherein we do major and minor surgeries, opta and ortho surgeries, and all the minimally invasive surgeries. And soon we'll have our lithotripsy. It's the only one within the area and we can do the ESWL, or what you call the shock wave for stone treatment or stone disintegration. And this will be our Eye and Vision Center, which has the following capabilities. We will have laser treatment for diabetes and glaucoma. We do modern cataract surgery in our OR. Even corneal transplant, we have the expertise here with our doctor's expertise here. And squint surgery, yung mga duling na gagawin ng paraan. And eyelid surgery. We do also treatment for age-related macular degeneration, or yung sa pagkakatanda nasisira yung mata, which is increasing daw ngayon because of the gadgets. We have pediatric ophthalmology. We can do glaucoma screening, LASIK screening, and eye ultrasound in our soon-to-open Eye and Vision Center. just to walk you through our rooms, although later we will have an ocular walkthrough. Sorry. Okay. So this is our 5-bed ward. It's quite spacious. It's the most spacious ward across all the hospitals in the area, even in Metro Manila. This is our inpatient private room. So sabi nga ng ating host earlier, masayang magpagaling dito sa Qualimed Santa Rosa if you have that room with a view, di ba? The environment. Okay, this is our junior suite, which provides for a receiving area. And the only hospital in the Qualimed network, kami lang yung merong executive suite, precisely because we have a lot of expats and foreign executives within the area. So we have that. And this is our 5-bay emergency room. Our 1.5 Tesla MRI. Our CT scan, the only in Santa Rosa. Our digital X-ray. The OR, which was highlighted earlier. And in Santa Rosa also, Santa Rosa has the highest population growth rate in terms of birth at 13% across all the country, among all the cities in the country. The others, single digit lang, dito yung 13%. So we'd like to support that by giving them a very pleasant birthing experience through our birthing suites, wherein the family can join during childbirth or during labor. Our dialysis and IV therapy center, our rehab and sports medicine unit, and right now we're accredited with all the major HMOs. We also have our bundled packages, so for childbirth, normal spontaneous delivery is at 29,990. For CS, that's just 49,990. That's inclusive of all, even the care for the newborn. And we're launching also our circumcision package, lalo na sa May, tsaka sa Sabado de Gloria. And PHIC, or no balance feeding packages in accordance with PhilHealth coverage. Right now, we're offering these promotions wherein we offer ECG, chest X-ray at 199 pesos only, and we're extending our opening discount of 10% on all our services. And with our dialysis, we have our no cash out dialysis for PhilHealth members. Wala silang ilalabas as long as they commit for 10 treatments, and they're covered by PhilHealth. For those who have already exhausted their PhilHealth, our dialysis per session is the lowest in the area. That's at 40% off of 2,600 only. And we're the only facility here who is offering the hemodiafiltration unit. So it's a special dialysis equipment which provides for better outcomes, and also in terms of the dialysis experience, it's lighter on the part of the patient, so hindi siya masyadong nasi-stress. Okay. So I think that's all for Qualimed Santa Rosa. I'd like to welcome you again, and later on we'll show you around the hospital. Thank you very much, everyone.
All right. Thank you so much, Attorney Nico. Thank you very much. Okay, that's interesting, huh? Hindi na kailangan lumuwas ng city just to get affordable and quality and a reliable healthcare service.